They're having a new CEO for Alberta, for health services. His name is Stephen Duckett. He comes to Alberta from Australia, so they didn't even hire within Canada, they went outside of the country to hire. He will be earning an annual salary of $575,000 with a bonus of 25% on performance. He will also get a vehicle allowance, medical allowance, and contributions of $20,000 a year towards RRSPs. Now, yes, he's done a good job in Australia. They now have a two-tier system, which is public and private. Is that what we want? I don't think so. I'm just going to quote. It's a fabulous opportunity to provide leadership not only within Alberta, but within Canada. So is this a forerunner of what's going to happen, not only in Alberta, but the rest of Canada, including Ontario? I hope not. Anyway, the plan of action is, we have petitions, we have two tables, we have one at this side of the room and one at that side of the room, and if you would wish to pick up a petition to sign, it's one way of letting your voice be heard, albeit on paper. It will be heard, because we have addresses where you can send letters to. We also have 3 sample letters that you can pick up if you wish, or you can put it into your own words and let these powers that be, the Ontario government, know how you feel about losing your hospital services and beds. So at the end of the evening, ladies and gentlemen, if you wish, the letters are there for you to look at, to peruse. You can take them home with you. The petition is on the table. If you wish to sign it and leave it here, that's fine. If you take it home, we would like for you to leave your name and phone number so that someone can contact you to pick up the petition at a later date. And the petition has room for, I believe it's 10 signatures. So if your neighbour's not here with you tonight, maybe it would be a good idea to go knocking on a door and to ask if they will sign the petition too. Thank you so much.
Voice really wasn't theirs, that it was all window dressing, all these public inputs and everything, and that was a Lynn board member talking to me after.
Okay, Natalie, you want to respond to something? I'm not...
I just wanted to give a little bit of a different picture about the spending question, and I understand that every MPP is given sort of a briefing note from the Ministry of Health about these things, and so I understand the numbers that you're talking about, and we're hearing them everywhere across the province, but there's a difference between healthcare spending as a whole and hospital spending. And hospital spending has been shrinking as a percentage of healthcare spending for years. In fact, our hospitals have been restructured now for 15 years. And our concern is that there's nothing left to cut in hospitals. If you want to cut hospital budgets, you're going to have to pay a lot of money to renovate other hospitals, to move those services, to build new long-term care beds, to lay off staff, et cetera, et cetera. There's no guarantee at this point that this restructuring will save any money, just like the last round of restructuring didn't actually save money, but did disrupt care and services dramatically. But the other thing to know is that Ontario's hospitals are actually funded less than every other province in the country. So there's no evidence at all that Ontario's hospitals, even with the problems that you're identifying, and I totally agree with, about administrative costs, even including that, Ontario's hospitals are funded at $100 less per person than hospitals in every other province in the country. And that may not sound like much, but when you total it up across the whole province, that's $1.2 billion less than hospitals in other parts of the country. So that's a significant fact. I think what's happening now is that there are people in the Ministry of Health who really believe that the last round of restructuring was correct and that they just didn't go far enough. And they're trying to push through what they weren't able to get through the last time. And you know, the same proposals that they tried to push through under the Harris government, closing Petrolia's emergency room, turning it into an urgent care center, closing down Wallaceburg, closing down Port Colborne and Fort Erie, closing down Picton, they're all the same proposals that are being floated again this time. And I think they'll have the same results that they tried, you know, when they tried to do it last time, which is more cost with actually less service. The other thing to note is that in the recent federal budget, there was an announcement of an increase in the health transfer. So the federal government collects the income taxes, transfers money to the provinces for health care. And they increased the transfer by $870-something million for health care for Ontario. That's more than enough to fund out every hospital deficit across the entire province. So at this point, I believe that this is much more an ideological drive for restructuring and much less actually about money.